cranial nerve number 8, and that's going to involve the vestibular cochlear nerve, and it's going to involve hearing and vestibular sensation. Okay, so for hearing, I'm going to be touching my fingers and wiggling them around both sides of your ears at different times, and I'm going to have you tell me if you hear them or you don't hear them, okay? And then the other one is going to involve, you're going to hear either conductive hearing loss. We're going to detect that if you have any of that. Hold on one second, I want to cut that out. Sorry, hold on. What's it called? Conductive. Okay. So I'm going to be understanding if you have conductive hearing loss with bone or air conduction. So now I'm going to have you close your eyes for me. Okay? All right. And pull your hair back for me. All right, so I'm gonna be, you let me know when you hear my fingers moving, okay? And point with your finger on which side you feel it on, okay? All right. All right, go ahead and open your eyes for me. Okay, so this next one is I'm gonna have you cover your hand, your ear with your hand, and you're going to then hum, and you're gonna let me know after you're done humming, which ear you felt or heard the humming louder in, okay? All right, so go ahead and cover either ear, okay? Go ahead and hum for me. Okay. And go ahead and cover the other ear. Again. Okay, now I'm going to cover it with my hands, okay? Which one do you, go ahead and hum again. Okay, and then other ear. All right, so when your hand was covered over your ear, which one, was it louder or softer?
It was louder when I covered my ear.
Okay, all right. And the next one is the vestibular sensation. So I wouldn't normally test vestibular sensation unless the patient detected otherwise in the history. Is cranial nerve number 9 and 10, and that's going to involve the gag reflex and palate elevation. Okay, so I'm going to use this clean wooden stick, and I'm going to put this in the back of your tongue, and I'm going to have you say ah. I'm going to evaluate what I see inside and seeing if your gag reflex is okay, and if you're able to elevate your palate, okay?
Okay.
All right, stick out your tongue for me. Let me know if you experience your pain or discomfort, okay?
Okay.
Say ah. One more time, ah. Great. Intact gag reflex and palate elevation, muscles of articulation. That's going to involve cranial nerves number 5, 7, 9, 10, and also 12. All right, so this is going to involve some articulations of speaking and using your tongue movements. Okay, so I'm going to tell you exactly how I want to do it during the test, and I'll just demonstrate it, okay? All right, so our first one is going to be ta 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 ta. Doing that for me.
Ta 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 ta.
And you're gonna go ahead and say ga 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 ga.
Ga 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 ga.
And then you're gonna say da 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 da.
Da 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 da.
Okay. Normal presentation of articulations of the muscles of those cranial nerves. One is cranial nerve number 11. That's going to be spinal accessory nerve, and that's going to evaluate the patient's sternocleidomastoid and the trapezius muscle, upper trapezius. All right, so this is going to involve 3 different testings. So I'm going to have you turn your head to the side, and then both sides, and then I'm going to have you resist my motion when I push your head towards the opposite side that you're turning your head on, okay? And the next one's going to have you shrug your shoulders, and then I'm going to be pressing down on both your shoulders, and you're going to resist my motion. And then the last one, I'm going to have you move your head forward, and then I'm going to press it back, trying to push your head back, and you're going to resist that as well, okay? Just let me know if you experience any pain or discomfort, and then we'll go ahead and stop the test, okay?
Okay.
All right. So go ahead and turn your head to the left. Okay. Go and resist my motion. Good. And then turn your head to the other side. Okay. Resist my motion. Okay. All right. And then I'm going to have you shrug your shoulders for me. Good. I'm going to be pressing down on them and resist my motion. Okay. All right. And then for the last one, I'm going to be doing is go ahead and protrude your head forward for me. Good. I'm going to be pressing back on it. 1, 2, 3. Okay. All right. So the patient presented with deficits in the left side of her neck and of her stridocleidomastoid and her upper trapezius, as the patient could not resist my motion when it involved her left sternocleidomastoid with turning her head. And then with her shoulder elevation and resisted motion, her left side was very much weak. And then with the head protrusion, when I pushed the head back, the patient deviated towards her stronger side. Have you stick your tongue out like this? Go and do that for me. All right. Intact ability of cranial nerve number 12 for her tongue muscles being able to stick her tongue out in front of her. All right. That's it.